McKenzie technique explained for back pain. The McKenzie method, also known as mechanical diagnosis and therapy, MDT, is a system of diagnosis and treatment for musculoskeletal conditions, particularly back and neck pain. Developed by New Zealand physiotherapist Robin McKenzie, this approach is widely used by physical therapists and healthcare professionals to assess and manage spinal issues. Here's an overview of the McKenzie technique for back pain. Principles of the McKenzie method. Assessment and classification. The method begins with a thorough assessment to classify the patient's pain into one of three categories: derangement, dysfunction, or postural syndromes. This classification guides the choice of specific exercises. Active patient involvement. Patients are actively involved in their own treatment. They learn exercises and self-management techniques to control and alleviate their symptoms, reducing the need for passive interventions. Directional preference. A key concept in the McKenzie method is identifying the directional preference of movements that either centralize or peripheralize the patient's symptoms. Centralization involves the movement of symptoms toward the spine, while peripheralization involves symptoms moving away from the spine. McKenzie exercises for back pain. Extension exercises. For patients with symptoms that centralize with extension, exercises like prone press-ups are prescribed. These involve lying face down and pushing the upper body up while keeping the pelvis on the ground. Flexion exercises. If flexion, bending forward, centralizes symptoms, exercises may include seated flexion or standing flexion exercises. These movements help patients find relief by bending forward. Lateral shift correction. Patients with a lateral shift, where the spine is shifted to one side, may be prescribed exercises to correct this shift. Shift correction exercises involve specific movements to center the spine. Dynamic interventions. Patients are often given dynamic exercises and movements that encourage repeated, controlled movements in the direction that provides relief. These exercises are designed to promote self-correction and alleviate pain. McKenzie method process. Assessment. The therapist conducts a thorough assessment, including patient history and a systematic examination to determine the nature of the back pain. Classification. Based on the assessment, the patient is classified into one of the three syndromes: derangement, dysfunction, or postural. This classification guides the treatment plan. Treatment. Specific exercises and movements are prescribed based on the patient's directional preference. Emphasis is placed on the patient's ability to perform these exercises independently. Education. Patients are educated about their condition and provided with tools for self-management, empowering them to take an active role in their recovery. Prevention. The McKenzie method aims not only to alleviate current symptoms but also to prevent recurrence through ongoing self-care and exercises. It's important for individuals with back pain to consult with a qualified healthcare professional, preferably one trained in the McKenzie method, for a personalized assessment and treatment plan. Exercises and recommendations should be tailored to the individual's specific condition and symptoms.